Let's start with something which people have been experiencing very increasingly common, which is kidney stones and kidney health.
The first time the kidney stone was identified at El Emra, an Egyptian mummy, 4000 BC. That's about 6000 years ago.
What actually causes kidney stones?
Because of the lifestyle changes, what has happened is we have a lot of preservatives, which contains a lot of salt. Now, this salt causes excretion of calcium.
Drinking less water, the only cause for kidney stones.
They form stones. It crystallizes. The crystals become larger in size and they become stones.
So what are the warning signs or the red flags when you're talking about kidney stones?
It's a very, very common condition. 1 in 10 men and 1 in 35 women will have kidney stone at some stage of life.
So what exactly is the prostate gland?
A small gland which is situated just below the urinary bladder.
What are the warning signs in respect of the prostate gland?
After age of 50, it is the second most commonest cancer in the body.
When do patients need surgery instead of medicines?
What we need to understand that every patient of prostate don't require surgery.
Hello everyone and welcome. Today we will be discussing certain health concerns which people silently live with. Frequent urination, multiple time waking up at night, and symptoms which they often ignore until it becomes a part of their daily lifestyle. Patients assume these changes to be normal, frequent delay of their treatment, and often assume that these symptoms may get better with time. But early awareness is crucial. To help us understand these concerns better, today we have Dr. Utture, an experienced urologist known for his work in kidney stone pain management, prostate care, and advanced, minimally invasive urological treatments. Thank you, doctor, for taking your time with us and being with us today.
Hello, Iram. Nice to see you. Nice to talk on my very favorite topic on prostate management and kidney stones.
Thank you, sir. So let's start with something which people have been experiencing very increasingly common and which has affected across all age group, which is kidney stones and kidney health. So sir, is this a new age problem or it has been existing since ages?
Kidney stone has been existing for a very long time. The first time the kidney stone was identified at El Emra, an Egyptian mummy, 4000 BC. That's about 6000 years ago. And from there on, the kidney stones numbers and incidence has increased because of lifestyle changes. 1 in 10 males and 1 in 35 women will always have one stone at some stage of their life, which they have it. So it's a very, very common problem. That's what we come across. And once we identify that, we try to treat it so that they don't create any kind of complications.
Great to know that, sir. It was quite insightful. So, sir, what are the early warning signs of kidney stones that people commonly ignore?
First thing that happens is you start getting pain. Now, this pain is called as loin to groin pain. It is a very typical pain which starts at the upper part of the abdomen and starts going towards your urethra or the testes. This is called loin to groin pain. This is an intermittent pain, and sometimes it can be so severe that it can be second worst pain only after delivery pain. So whenever you get this kind of pain, people many a times think that it is acidity related problem. It is usually associated with nausea, vomiting, and many a times they think that it's a muscle pull. So when these things happen, first thing that what you need to do is you need to see a general physician or a urologist and try to get a sonography done. In sonography, we would like to see that how big is the stone, where are the stones, and whether they are creating any problems onto the kidney in the form of obstruction of the ureter, because of which there could be a possibility of obstructive uropathy in the form of hydronephrosis and hydroureter. These are the things that the patient should very much look forward to whenever they get this typical pain, which is loin to groin kind of a pain.
So that is definitely great to know. Our audience will definitely able to differentiate between the different types of pain and when to consider a physician and a urologist. Moving on next, what actually causes kidney stones? Is it only dehydration or something else?
The commonest cause has been dehydration. Now consider 4 teaspoonfuls of sugar and try to put it into a glass. What will happen? All the sugar will remain at the bottom of the glass. But same thing, you transfer into a bucket full of water, what will happen? Everything will get dissolved. That exactly is the mechanism for which the stones are formed. Stones are nothing but these are the calcium, uric acid, cystine, these kind of crystals which come together, they start growing in size, they become bigger and form kidney stones. But this is not the only reason why you can get kidney stones. Another thing that what you see across is diet. The diet is very high in contents of calcium, red meat, oxalates, then these stones formations are very, very high rate. Now, because of the lifestyle changes, what has happened is we have a lot of preservatives. We have a lot of processed meat, which contains a lot of salt. Now, this salt causes excretion of calcium, which goes into the kidney, into the urine. It gets accumulated there and they form stones. So mainly what you see is diet and water. But along with that, there are many, something called as a kidney stone belts all over India, like Kutch or maybe Rajasthan, or in Maharashtra, you see interior of Maharashtra, where the calcium content of the water is so high that even if you have a lot of water, just because the calcium content in the water being high, which excreted into the kidney in the form of urine, where the calcium levels are high, you can get this kidney stone formation. Again, the diet, which is high in purine contents, that is like red meat, this causes uric acid levels being high. There are various medical conditions like parathyroid adenomas. Then you can get gout. Then you can get intestinal multiple absorption syndromes, because of which this calcium and oxalate levels excretion in the kidney increases. And because of that, there can be a formation of stones.
So, sir, diet and lifestyle modifications definitely play a very important role in our kidney health.
Definitely so.
Moving on, so what are the warning signs or the red flags when we're talking about kidney stones, and what are the symptoms which people usually ignore?
As I said, that it's a very, very common condition. 1 in 10 men and 1 in 35 women will have kidney stone at some stage of life. Now, this stone need not be metabolic stones. That is, they have some metabolic problem because of which the stone formation. Many times they can be dehydration stone. In fact, majority of the stone are dehydration stone. So first thing what you need to do is you need to have at least 2.5 to 3 liters of water. Now, this water should not be 1 liter in the morning, 1 liter in the afternoon, 1 liter at night. It should be 1 to 2 glasses water every 1 to 2 hours. Now, what you need to see is that whenever you are passing urine, the urine color has to be pale yellow or white. If it is showing dark color or bright or maybe a dark yellow color, that means you are in a state of dehydration. In that case, you need to have water. Once the water comes in, all the calcium salts, your oxalate salts become diluted, and they are very much easily excreted through the urine.
So, sir, since you mentioned about water right now, so is drinking less water the only cause for kidney stones, or there are other causes also?
As what we have seen is that drinking water, if the water is less, that causes in a state of dehydration. When there is a state of dehydration, what happens is the calcium excretion from the body increases, and this calcium in the urine, when it gets accumulated, they form stones. It crystallizes. The crystals become larger in size and they become stones. So among all the reasons why a stone is formed, dehydration and drinking less water is the most important cause, in my opinion.
What is minimally invasive surgical options, and why should you advise this to your patients?
As you know, that 1 in 10 men and 1 in 35 women will have stone at some stage of their life. Any option that what we consider as far as the stone treatment is concerned, it should always be in the form of minimally invasive therapy. Because also you must remember that when you have one stone in one kidney, 7% per year, so 50% of these patients will reform stones in the kidney. When you have 2 stones, or when the stones are twice or 3 times formed, this can go up to 68 to 92%. So whatever option that what we offer to these patients, it has to be something called a minimally invasive therapy. Now, minimally invasive therapy means it is devoid of any cut or stitches. The first treatment that what we come across is something called as ESWL, shockwave lithotripsy. With this, what we do is we give electromagnetic and electrohydraulic waves which go and hit the stones, make it into powder form, and they are excreted. But this kind of treatment has got limitations. Very large stone and very hard stone cannot be treated with this. So what we have is, if the stone is in the kidney, we do something called as flexible ureteroscopy with lasers. Flexible ureteroscopy, this has changed the entire way, the way we look at the kidney stones and give management option. With this, we can break any kind of stone which are there in any part of the kidney, and however big is the stone, that we can take care of. Third thing that what we have is something called as PCNR. When the stone is very, very large, which we call it as a staghorn calculus, then what we do is we make a small opening in the kidney, go inside the kidney, use lasers or lithoclast, which is an electrohydraulic hammer with which you break the stone and take them out. If the stones are situated in the bladder, we do something called a cystolithotrypsy. That is, with an endoscope, we go inside the urinary bladder, use the lasers and break the stones, make it into small fragments and suck them out. So this is called as minimally invasive therapy. As against that, we have to understand that whenever we used to do any operation for the kidney, that used to involve cutting 3 group of muscles, very long incisions, maybe 20 centimeter or plus, or taking out a rib, which was the 12th rib inside to approach the kidney. So by doing this, doing the minimally invasive therapy, we can avoid a regular long incision and a difficult operation to take care of the stones.
So, sir, as we are on the topic of minimal invasive surgery, so how does the laser surgery treatment works and when is this specific surgery needed?
Let's understand that laser is light amplification or stimulated emission of radiation. This is an energy source. The other energy sources that what we use is electrohydraulic hammer. The best thing what is available today is holmium lasers and TFL lasers or thulium fiber lasers. Now what this does is we do an endoscopic approach, reach the stone, and once we reach the stone, through the side channel through which the laser is introduced, we introduce this laser, touch the stone and break the stone into multiple small fragments. This becomes into a powder form. The idea is to break the stone less than 3 millimeter so that there is a spontaneous expulsion of these fragments. With these lasers, we can reach right up to 50 to 100 microns, that is 0.05 to 0.1 millimeter of small fragment of the stone with which it can come out. So that's the advantage of using a laser in any kind of operation for kidney stones.
So, sir, what makes your treatment approach and team different from others while managing kidney stones?
Now, whenever you are looking at the kidney stone and kidney stone related treatment, it is not only the stone which is formed, that stone has to be treated. Now, you have to have a multi-pronged approach. Now, whenever any patient comes to me for kidney stone management, what we do is we do a sonography, we do blood test where we involve a good radiologist who looks after the sonography, gives us an idea of whether there is a pressure onto the bladder and what is the emergency of treating this kind of particular stones. Then we involve pathologists who evaluate all the stones and they give us good reports about the contents of calcium, uric acid, phosphorus, parathormone hormones, so that we know that why these stones are forming. So we also involve nephrological friends who help us in giving 24 hours urine sample data, in which we see whether there is a good amount of citrates which are present in the urine, whether there is a hypercalciuria or hyperoxaluria, which can be treated by giving thiazides, kind of a diuretic. And if there is a problem as far as the uric acids are concerned, we can give allopurinol, which decreases the uric acid contents of the urine, and because of it, the stone formation is less. In this, I also involve a dietitian. The dietitian looks after these parameters in the biochemical analysis, and if you already operated and picked up a stone small fragment and done a chemical analysis, depending upon the type of stones, these dietitians advise adequate hydration and various dietary advices where few things are to be taken more or few things are to be taken less in the diet so that the recurrence rate becomes less. So whenever you have this kind of stone management treatment, we always look at stones which are already formed treatment and always look at preventing the stones so that there is no recurrence.
So, sir, in your experience, is kidney stones becoming more common nowadays?
The incidence of kidney stone formation is definitely become nearly double in last 1 or 2 decades. Now, this is happening because the pickup rate is very good. In various smallest possible centers, villages, sonography is available. So stones are picked up very much quicker, faster, so that we are aware that these stones are forming very fast. At the same time, what we need to understand is that the dietary habit are the changing factors. You are into the newer generation, Gen Z, they are into processed foods and lot of fast food material that what they have. They eat a lot of processed meat, processed cheese, which are very high contents of sodium chloride, that is salt. When the salts are more, the calcium excretion is more. When the calcium excretion is more, that's the time you see that the stone formation is very high. Another thing that I would like to mention is that there is this gym culture. People go to gym, They have a lot of protein shakes, etc. Now, these can be again commonly divided into three parts. One is protein shake, which comes as a whey protein. In the whey protein, what happens is the body is constantly in a phase of acidification. The urine is acidified, because of which more and more calcium from the bone is picked up by the body, which is excreted in the form of calcium. This calcium comes down into the urine and they form stones. Second part that what we see is purines and various amino acid supplements. Now, these amino acids and purine supplement increase the uric acid levels, and uric acid stones, as we know, they combine, they appear as a single uric acid stone, and they can appear with calcium as mixed kind of stones. Third thing that what we come across is vegetarian, veg-based, these kind of protein supplements. They are very high contents of oxalate. These high oxalate contents are excreted into the urine. They combine with calcium, form calcium oxalate crystals, calcium oxalate stone, and they form stones. So that's the reason why we come across many patients who are forming stones and are identified with stone formation in.
So one take-home message we can take is that diet plays a very important role in your kidney stones health. And secondly, that a protein intake should always be measured before having any decision further. Secondly, sir, how painful can kidney stone pain can become, and when should they immediately consult a urologist?
The warning sign can be pain in abdomen, as what I mentioned, loin to groin pain associated with nausea and vomiting. That means the pressure on the kidney is too much, because of which the patient has started vomiting. Third thing that what you should see is that if there is any blood in urine. If there is blood in urine, that means the stone is getting impacted, and when it is coming down, it is injuring the kidney, ureter, or the bladder. So these are the three signs whenever a patient comes across. They should immediately do a sonography, they should see a urologist and ask for treatment as far as the kidney stones are concerned.
How long is the recovery period after these surgeries, and are these procedures painful?
These procedures are absolutely doesn't have any pain. We do it under a small general anesthesia or spinal anesthesia, where the patient doesn't get pain at all. Now, as I have said that we are nowadays dealing only and only through what we talk about minimally invasive therapy, there are no cuts and stitches on the body. So the patient gets admitted in the morning hours, we operate upon the patient, and maybe evening or next day morning, the patient goes back home. He can go back to work the third day. So this is the advantage of having treatment for these kidney stones with minimally invasive therapy.
So sir, let's move on to something which many men experience but very few openly discuss about it, which is prostate health. So what exactly is the prostate gland?
Prostate gland is a small gland which is situated just below the urinary bladder. It's a chestnut shaped. It is about 18 to 20 grams. And as the age advances, maybe 50 years and plus, the prostate gland starts enlarging in size. And when the prostate gland enlarges, the flow of urine from the urinary bladder becomes less, and you have symptoms which you call it as lower urinary tract symptoms or LUTs.
So what are the warning signs in respect of the prostate gland?
Whenever you come across prostate gland symptoms, these symptoms can be divided mainly into two parts. The symptoms of this prostate can be divided mainly into obstructive or irritating kind of symptoms. The irritating symptoms are urgency, nocturia, and frequency. Urgency is you feel very urgent to pass urine. So when you feel like passing urine, you try to reach the toilet. Before that, there is probably a leakage of urination. Nocturia, this is the first symptom to come. Normally, usually patients do not get up at night to pass urine. Up to 2 times getting up is normal. But if you are getting up more than 3 times or more than 3 times, that means that you are having prostate-related problems, especially after the age of 50 years. Second part is obstructive symptoms. This happens because of the enlargement of the prostate. When the prostate enlarges, the urethra gets compressed. In that case, what happens is you have decreased stream, interrupted stream of urine, and when you pass urine, you think that some amount of urine is remaining back in the bladder. After passing urine, you feel that the flow of urine is not as much as what it used to be during the younger age. It falls close by, you start wetting your clothes, and these are all called as obstructive symptoms because of prostatic enlargement.
So sir, is frequent urination always related to prostate?
Above the age of 50, it is the commonest cause. But along with that, we should always remember that there is a possibility that there can be a bladder stone, there can be a uretrovesical junction stone, there can be infection in the bladder in the form of cystitis, there can be tuberculous bladder, there can be diverticulum, or there can be a cancer of urinary bladder. All these things can lead to urgency and frequency of urination. But the commonest cause is always prostatic enlargement.
So, when do patients need surgery instead of medicines, and what are the various modalities of surgeries available?
What we need to understand that every patient of prostate don't require surgery. Initially, whenever any patient comes across, we always do evaluation. Our evaluation modality is in the form of sonography, which we do pre-void and post-void residue to see how much urine remains back in the bladder. We do uroflowmetry. We do PSA test. This is one of the most important tests what we do across after the age of 50 years, because prostate cancer after age of 50 is the second most commonest cancer, which can easily be detected very quickly and treated quickly. So when we do this investigation and we realize that the patient has prostate problems, we start the patient on anti-prostate medication. This anti-prostate medication we continue doing with the same for 4 to 6 weeks. We repeat these parameters and see how good is the response. More than 90% of the patients don't require any operation nowadays for prostate enlargement. 90% patient can be managed with medical line or treatment, and only this 10% patient who require treatment undergo prostatic surgication.
So, sir, what are the presentations or the symptoms which you patients usually come with regarding to prostate?
Prostate patient symptoms usually we divide into two parts. There can be obstructive symptoms or irritative symptoms. The obstructive symptoms are decreased stream, interrupted stream, feeling of incomplete evacuation of bladder after you pass urine. There can be urgency, there can be nocturia, that is you get up more than 2 times to pass urine, and there can be frequency. Initially, what used to get up at night once or twice, when you start getting up 2 to 3 times or more than that we call it as a nocturia, which is the first symptom which occurs because of the prostatic enlargement. So when you start getting up more than 2 to 3 times and all these symptoms come up, what you need to do is you need to go to a physician or a urologist and try to evaluate your prostate gland.
So, sir, how do we go on further investigations in respect to any prostate disease?
Whenever any prostate related patient comes to my outside patient department, first thing we do is we take a very detailed history. We understand that how much he is suffering from this urgency, frequency, nocturia, interrupted stream, etc. How long this presentation is. Then we ask about whether there is this kind of history related to his uncles, father, grandfather, etc. Then we ask about cancer prostate. Now, this cancer prostate is very, very important aspect, because after age of 50, it is the second most commonest cancer in the body, as far as the males are concerned. After we take a detailed examination, what we do is something called as a per rectal examination. In this, we check the patient from his backside, from where he passed stools, and we evaluate the prostate gland. There we see the size of prostate, whether there is a nodularity, and we see that if there is any kind of suspicious areas which are found on prostate gland. Once this evaluation is done, then we do investigations. Our first investigation is sonography, which gives us the size of prostate and how much urine remains back in the bladder. Along with that, we also do something called as urinary flowmetry. In this, we make a patient to void in a commode, which tells us that how good is the flow. Another thing what we do is we do urine routine microscopy and culture test to see that there is no infection, and we do a PSA test. So when we are having all these investigation, the first line of treatment that what we look at is the patient is always treated with medical line of treatment. Now many patients have got this myth that prostate enlargement means you require surgery. But today, more than 90% of the prostate symptoms related patients are treated with medical line of treatment. And only when the medical line of treatment fails, we go and consider in the form of surgical line of treatment.
So, sir, as you mentioned, that when do medication stops and surgery becomes necessary, and how does surgery help prostate patients?
Very good question. Now, whenever we are giving a medical line of treatment, we always do, as I said, that we do sonography, we do urinary flowmetry, and we keep on asking the symptoms to the patient. When we realize that more and more urine is remaining in the bladder, prostate size has increased, and the urinary flow rate has decreased in spite of medical line of treatment, that's the time these are the warning signs as far as the symptoms and signs are concerned, as far as the patients are concerned. We also look at whether there is secondary problem in the form of bladder stone formation, pressure on the kidney in the form of hydronephrosis, hydroureter because of enlargement of the prostate, or if there is recurrent infection which are setting in because of prostatic enlargement, and if there is any bleeding which is occurring in the urinary bladder. These are the signs which gives us an idea that the medical line of treatment is failing, and we usually advise the patient to go for surgery.
So, sir, doctor, what exactly is minimal invasive prostatic surgeries and how it has changed patients' experience?
Whenever we used to deal as far as the surgery was concerned, as far as prostatic enlargement, it used to always be an open operation. Now this has been replaced by endoscopic procedures. Endoscopic procedures, how it is different from a laparoscopic procedure? In laparoscopy, we make holes in the abdomen and go inside and tackle the organ. In endoscopic procedures, we go through the urethra, that is the channel through which the urine comes out. The scopes are very, very small. We reach the prostate gland, look at the prostate gland and offer the treatment. So in minimally invasive therapy, we do not have any cut or stitch on the body, because of which the recovery is very fast. Patient doesn't have to do any dressing, and patient can go back to work after 3 to 4 days after the operation. That's how minimally invasive therapy has completely changed the scenario as far as prostatic management is concerned.
So, sir, how long is the recovery after the prostatic surgery and what improvements do the patient notice after the surgery?
Now, prostatic recovery depends upon what is the modality of treatment that is available. Now, in minimally invasive therapy, we have something called as transurethral resection of prostate. This used to be a gold standard treatment which is there for last about 60 years. But because of a bit of complication rates, various other type of treatment options are available, which can be laser operation, which can be holmium laser prostatectomy, thulium prostatectomy, green light laser prostatectomy. Other modalities available are something called as bipolar plasma kinetic TUR prostate, which is one of the safest and one of the best possible methodology to treat this prostate gland in the form of minimally invasive therapy. If the patient is young, is worried about his erection and ejaculation, we can offer something called as urolift procedure or injection of steam at a very high temperature inside this prostate gland, because of which the size of the prostate decreases and the patient can have good flow of urine, can maintain his erection and ejaculation. So these are the minimally invasive therapy which are available. If we operate upon prostate gland with lasers or endoscopic TRP or plasma kinetic resection, admission time is 4 to 5 days. Patient remains in the hospital with catheter for 4 to 5 days. Day 5 or day 6, we remove the catheter. Patient goes back to work on day 7 or day 8.
So, doctor, would you like to share an experience of a patient whose drastic improvement in their symptoms after the surgery?
One patient that I would like to say definitely is that one patient we come across who had 8 stents. He underwent angioplasty 3 times and he had totally 8 stents. So when we talked about the cardiologist regarding the medical line of failure and patient requiring surgery, the antiplatelets that what we usually give for these stents, it was impossible to stop these antiplatelets. So in this particular patient, what we did was the long-term, long-acting antiplatelet we stopped. We went on to short-acting injectable antiplatelets. We operated upon this patient. Patient had fairly large prostate, about 65 to 68 grams. We operated this patient with something called as a bipolar TUR prostate. Patient's surgery went very well. Patient recovery was very good. There was no bleeding in the post-operative as well as the later on period. This patient is following with me for nearly 2.5 to 3 years. Now, this patient would have had to undergo something called as a permanent catheter in the penis or permanent catheter in the form of suprapubic catheter, and I had to live with this catheter. Now, this patient is not very old. He's roaming around all over the world. Whenever he goes abroad, he sends me a WhatsApp message saying that, "Thank you, doctor, because of which I can roam around so freely, can do whatever is that I please to do and without a catheter." So this particular one patient that I always remember, where we took a cardiologist into our team. We decided that the patient required surgery. We had some modification in his anti-prostate medication. We operated. So with this minimally invasive therapy, what has happened is high-risk patient who is to not get operated, who is to be kept on to catheter for a very prolonged period of time. With this minimally invasive therapy, we can operate upon these patients and they can have a catheter-free life. Now, one thing that what we have to understand and realize is that prostate enlargement and the symptom is not the only reason why we operate upon this prostate. We operate upon this prostate because if the prostatic obstruction remains for a very long time, it can lead to bladder failure. So just to save your bladder, we need to operate upon these patients. And if they are high-risk patient, minimally invasive therapy is the best possible option. Now, when the bladder becomes a hypocontracted detrusor or it goes into failure, even if we operate, still the patient cannot pass urine. So early investigation, early determination of the problem, treating the patient with medical anno treatment, and failure of medical anno treatment, immediately going in for minimally invasive therapy is the key to success.
Doctor, after hearing this, definitely our audience will have the less fear of surgery among them and importance of how the prostatic health should be created awareness. Do kidney stones only happen because of less water, or frequent urination above the age of 50-55 is normal? Let's break the myth from the facts and hear it and uncover the truth by Dr. Anand Utture. After laser surgery, kidney stones returns back.
As what we have seen is, if the stones are formed, you have got 50% chance of stone formation again, 7% per year. So if you have one stone, you have 50% chance that you may form stone again. So you have to be very careful as far as the hydration, your dietary intake, and taking supplementation of proteins, etc. are concerned, because these are the causes which can form recurrence of stones.
Frequent urination above the age of 50 is normal.
Above the age of 50, there is a prostatic enlargement, because of which there can be urgency, frequency, nocturia, decreased stream, interrupted stream, decreased flow of stream. All these things because of prostatic enlargement can happen. This is normal, but it should not be taken as normal and not done anything about it. You need to see a physician or you need to see a urologist, get your prostate checked, do your PSA test, see that there is no cancer ailment, start the anti-prostate medication and manage your prostate with medical anno treatment.
As doctor, you mentioned cancer. Prostate problems always means cancer?
As the age advances, the chances of prostate cancer increases. Above the age of 50, it is the commonest cancer in the body, but it can be detected by doing a very simple blood test, which is we call it as a PSA test. So every prostate enlargement need not be cancer. Till the age of 50 to 60, only 10% of prostatic enlargement can be cancer. 90% can be benign enlargement of prostate, which can be treated with medical anno treatment. So every prostate enlargement is definitely not a cancer.
Surgery is the only option in prostate treatments.
90% of all the prostate enlargement patient can be managed on medical anno treatment. When the medical anno treatment fails, that's the only time we think about surgery. Now, this surgery is always minimally invasive therapy, where there are no cuts and stitch on the body. We do minimally invasive therapy and take care of the enlarged prostate so that the patient can have devoid of symptoms of prostatic enlargement.
So, a last question. Any take-home message you would like to have to give to the prostate patients?
First thing that what you have to understand is prostate patient. It is not a patient. It is an age-related condition with which an individual is following up in your OPD. All these things can be managed with medical anno treatment. You need not suffer in silence. My father had the problem, my grandfather had the problem, is not the reason why you should suffer in silence. Good medication will prevent urgency, incontinence kind of a problem where you can live a very normal life. At the same time, you should always understand that after age of 50, it is the commonest cancer in your body. So we have to do a PSA test to understand that the prostate is not going into a cancer phase. If we treat these patients very early, it is as good as cure. So I would like to tell my patients that after age of 50, you need to visit a urologist every 1 year, get your prostate evaluated in the form of sonography, PSA test, urine routine microscopy and culture, take medicines if it is required, and be prostate healthy.
So after your message, definitely our audience will be more vocal about their symptoms and be preventive of their health.
Thank you very much.
On behalf of Lilavati Hospital and Research Center, I would like to express my gratitude to Doctor for taking your time today and being with us and sharing your valuable information. After hearing this conversation, I hope you're able to recognize your symptoms earlier, prevent any delay in your treatment, and get as early possible treatment as possible, because it is aptly said, prevention is always better than cure. Thank you everyone for watching, and we'll meet in the next conversation ahead.